Dr. Sidney Hankerson.
Yes.
Pardon me. Dr. Simona Kwan.
Yes.
Dr. Michael Lindsay
Yes.
and Gail Nailwith.
Yes.
Thank you. Okay, I'll proceed to just some very brief opening remarks. We're here today to discuss a few issues that touch upon issues of surveillance and data collection. Surveillance, as you know, is a core activity of the Department of Health and of any Department of Health, including our National Department of Health, the Centers for Disease Control and Prevention. It is health statistics and the epidemiology of analyzing health statistics that gives us the ability to report, to plan, to allocate resources, and to intervene at appropriate change in the cycle of any disease, any condition, any public health threat that we face as a city. And so questions around reporting of illness are largely questions around issues of aggregation of data for population health planning. And so I just want us today to keep that in mind as we discuss and debate these articles and these notices of adoption, that when the health department and the city of New York requests to update its mandated reporting, we do so because we think that there's an opportunity to better plan, better resource, and better intervene to protect the public's health, to promote equity and justice. So it's with that that I will proceed with the meeting and beg your forgiveness with all of the paperwork here. So with that, let's move to the approval of the minutes from the October 24th, 2023 meeting. Are there any corrections to the minutes? Do I?
There are two small corrections that were made by two board members. So the minutes that you have before you are those that have been changed with those two small corrections.
Okay, very good. If there are no further corrections to the minutes from October 24th, may I have a motion to approve the minutes as distributed and amended? Second?
Second.
All in favor?
Aye.
Okay, any opposed? Okay, the minutes from the October 24th meeting are approved and distributed as amended. Okay, on to the items on our agenda. First item on the agenda is the proposed adoption of amendments to Article 11 of the New York City Health Code regarding reportable diseases. Our presenter is Dr. Celia Quinn, Deputy Commissioner of the Division of Disease Control at the New York City Department of Health. I will now turn this meeting over to Dr. Quinn.
Good morning, everyone. Thank you. All right, so I am here to talk about two notices of adoption, and these were proposals that we brought.
Can you hear me now?
Yes.
Okay. All right, so as a reminder where we are in the rulemaking process for these two notices. So this Board of Health approved the publication of these two proposed rules on October 24th, 2023. There was then a public hearing held on November 27th and no comments were offered at the public hearing, and we received no written comments about either of these proposals. So I'm gonna start with the first proposal, which is to amend the health code to add carbapenem-resistant organism, which I'll refer to as CRO, to the health code's list of reportable diseases for animals, which would make it reportable by veterinarians, animal care professionals, and veterinary diagnostic labs. So as a reminder, CRO are a growing public health threat. These are bacteria that are resistant to carbapenems and therefore have limited treatment options. And CRO outbreaks have occurred among animals within the US. The human public health risk from animal CRO is unknown, but we do know that CRO transmission across species can occur, and there have been documented cases of suspected transmission between animals and humans. So having reporting of CRO in animals required will allow the department to monitor CRO trends in animals to better understand the burden and the public health risks. It will help us to identify CRO clusters and provide support to animal facilities to prevent spread of these organisms within the animal facilities. And we can then develop guidance and interventions for CRO prevention and containment. So we can now answer questions and then vote on this proposal.
Thank you, Dr. Quinn. And at this time, we'll take questions from the board, and I'll call on each board member to give you space to ask any questions you might have. I'll start on my left with Gail Nailwith, who's joining us remotely.
Dr. Quinn, there have been no comments received from anyone. The public hearing had no presenters, so you haven't gotten any pushback or feedback from the field.
That's correct.
Thank you.
Dr. Henderson?
No comments at all.
Dr. Galvez? Dr. Kwan?
Thank you, Dr. Quinn. No questions.
Dr. Lindsay?
Just a question here that, I guess there's not been any, reports of humans being, impacted by this, but if it were to happen, are we prepared to respond and how?
Right, so there have been situations where it's suspected that a CRO was transmitted from an animal to a human. This proposal is about the lab reporting of CROs that occur in animals to us, and we would investigate those, work with the animal facility or veterinary diagnostic lab that is performing it to learn more. And this would give us the opportunity to learn about instances where we think that the CRO was transmitted from an animal to a human.
Dr. Acosta?
No questions.
Okay, that concludes questions from the board. If there are no further questions or comments, can I have a motion to approve the notice of adoption to amend Article 11 of the New York City Health Code?
So moved.
Second?
Second.
And now I'll take a vote from each board member individually. Gail Nailwith?
Aye.
Dr. Acosta?
Aye.
Dr. Galvez?
Aye.
Dr. Hankerson?
Aye.
Dr. Kwan?
Aye.
Dr. Lindsay?
Aye.
Motion passes unanimously. Thank you. Next agenda item is the proposed adoption of amendments to Article 13 of the New York City Health Code regarding laboratories. Again, our presenter is Dr. Celia Quinn.
Okay, go to the
Can we
next
advance
slide.
the slides?
There we go. Okay, so the next proposal is to amend Health Code Article 13 to require laboratories to report all negative syphilis test results, all negative and indeterminate hepatitis B, E antigen and surface antigen test results, and all negative and indeterminate hepatitis C antibody test results. So this is one proposal, but since it covers a few different diseases, I'm going to take each one at a time. So starting with syphilis, in New York City in 2021, there were nearly 10,000 cases of syphilis reported. And untreated syphilis can damage the heart, brain, and other organs and lead to life-threatening conditions. The negative test results can help to differentiate between evidence of prior infection and new reinfections, and can also provide information about the stage of disease. So reporting of all negative syphilis test results would allow the department to support earlier and more accurate diagnosis and linkage to care, as well as appropriate treatment, which would improve outcomes and reduce the risk of onward transmission of syphilis. It will also help us to monitor compliance with required syphilis testing of pregnant persons and ensure the follow-up testing of exposed infants. And all this will also help us identify opportunities to educate providers about this issue. So for the hepatitis B reporting proposal, there are about 243,000 people with chronic hepatitis B living in New York City, and there were more than 5,000 new cases reported in 2021. Chronic Hep B can lead to serious health issues, including cirrhosis and liver cancer. And reporting of the negative and indeterminate hepatitis B, E antigen and surface antigen test results would allow us to identify gaps in access to care and develop targeted interventions to help increase linkage to care and reduce inequities in outcomes related to Hep B. and can also help us identify opportunities to improve provider knowledge of Hep B testing and treatment guidelines, and overall improve disease monitoring at a population level. And then for the hepatitis C proposal, so there are more than 86,000 people estimated to be living with chronic hepatitis C in New York City, and nearly 3,000 new cases were reported in 2021. So chronic Hep C can also lead to serious health issues such as cirrhosis and liver cancer, and reporting of the negative and indeterminate Hep C antibody test results would allow us to better understand the overall disease burden in New York City, better differentiate at a population level between acute and chronic infections, identify instances of new transmission, and then to help detect case clusters. And this can help us develop targeted outreach to address inequities in Hep C outcomes, and further support earlier linkages to care and treatment, improving outcomes and reducing the risk of onward transmission. So we'll now have time to take questions on this proposal.
Thank you, Dr. Quinn. We'll take questions from the board. I'll go around again. Gail Nailwith,
No questions, thank you.
Sydney Hankerson,
Yeah, I had a question about the requirements for syphilis reporting. Under what circumstances would the lab be required to retest, or could you just describe the follow-up testing procedures currently and how, if at all, they would change?
Sure, so right now, positive tests for syphilis are reportable to the health department, so we only get the positive results. This proposal would mean that we also get the negative results, so whenever they're done, we would get those negative results. Because of the volume of syphilis that we have in New York City, this would help us to prioritize outreach to providers around certain populations where we're trying to have a targeted impact on outcomes.
Dr. Galvez.
You just answered the question. That's fantastic. I think it's great that you'll have that negative data and improve outreach and education to clinicians for caring for pregnant persons.
Yes, I'm especially excited about that part, and I mean, it'll also, as people remember from COVID, it will help us understand where the testing is occurring. Right now, we only know the positive ones.
And what you just commented on about syphilis is true for Hep C and B as well.
Right, so the testing for hepatitis C and B is a little bit more complex than for syphilis, but these different antigen and antibody tests that we're asking for will help us better stage and understand acute versus chronic, new infections versus reinfections, and similarly help us target our outreach and efforts, interventions for all of those diseases.
And previously negative tests were not reported.
Correct.
Thank you.
Dr. Lindsay,
No question.
Dr. Kristen.
So the requirement is,
Can you,
the requirement,
you have to press and hold it. So you have to press and hold it.
okay, the requirement is of the laboratory, not of the physician.
That's right.
So there's a physician who sees and turns 30 patients a day. When does the department get that result compared to when the physician gets that result?
So the reporting goes from the laboratory directly to our surveillance system, and then it's also reported to the clinician. So that may vary a little bit depending on the lab and whatever system the physician is using to order the laboratory result. But we don't anticipate this to cause any burden on ordering physicians, because again, the reporting is gonna come from the lab. And we work closely with the labs to make sure that information is reported to us electronically.
And particularly as it relates to positive results. If the Department of Health gets the result first, before the doctor does, is there any communication between the DOH and the patient? Or is it first with the doctor?
So I think normally the doctor would be communicating those results to the patient.
As they normally do, but
Yeah.
what I'm saying is the DOH does not reach out to the patient.
Right.
Thank you.
Very good. Any other questions or comments? Okay. May I have a motion to approve the notice of adoption of amendments to Article 13 of the New York City Health Code regarding laboratories?
Motion.
May I have a second?
Second.
And I'll take a vote from each member. Gail Nailwith,
Aye.
Hankerson,
Aye.
Dr. Galvez,
Aye.
Dr. Kwon,
Aye.
Dr. Lindsay,
Aye.
Dr. Acquista.
Aye.
Okay, with the unanimous vote in favor of the motion carries. On to our next agenda item. the proposed adoption of amendments to Article 203 of the New York City Health Code regarding termination of pregnancy. Our presenter is Dr. Gretchen Van Wy, Deputy Director and Chief Epidemiologist. I'll now turn my presentation over to Dr. Van Wy.
Good morning. Good morning, thanks everybody. I'm glad to be with you here today. Okay, today I'm here to talk about closing the amendment that we proposed in October and October 24th. This is an amendment to Article 203 of the New York City Health Code. I just wanted to back up and orient everybody to the importance of vital records data, so vital statistics. So our data, the vital records data, are incredibly important for characterizing the health of our population, understanding the influences on people's health, and understanding health outcomes. They're also important for understanding the fertility of a nation. Vital statistics data have diverse uses. They're a base for public health, so they're the major data source that was used for our recent agenda for Healthy NYC. They're important for social service planning and economic planning and program development. They help us track our progress towards our health goals. Induced termination of pregnancy data specifically help us at the department understand who has access and who does not have access to important medical services. And so induced termination of pregnancy data let us know whether certain groups are having that access. And they allow us, when we determine that there's a disparity or inequity, they allow us to focus our efforts. Really, we can't be accountable without counting. I'd like to also speak about the security of vital records data. So New York State and New York City have taken legislative action to protect patients seeking abortion care and those helping people seek abortion care. In June of 2023, earlier this year, the Board of Health adopted an amendment to Article 203 to align with then recent changes to provide the same strong level of protection for the confidential medical information about all terminations of pregnancy that had been afforded just too long in the past. And also, all vital records data are stored in secure electronic systems that meet really stringent security requirements of not just the New York City Health Department, but of our Office of Technology and Innovation. Another thing specific to induced termination of pregnancy data, it's really important to know, is that we request anonymized induced termination of pregnancy data. So that means that we're not asking for full names. We don't ask for full information about the person receiving the treatment. And so when these data are reported in reports or things like that, they're also aggregated, but they've come to us in a format that they're anonymized. That's unique to this particular type of event. So we proposed in October an amendment to the health code to specifically include and make clear that medication-induced terminations of pregnancy are reportable to the department within the definition of induced terminations of pregnancy. You know, interestingly, we have been doing this for a very long time and reporting out on this in our annual summary of vital statistics. And in that meeting, I even showed you a graph that showed the increase in medication induced termination of pregnancy over time over the past 10 years. We also specified that the reporting requirement include medication-induced terminations of pregnancy. And then we made little changes to the words. We added the word certificate and to proceed confidential medical report of a spontaneous termination of pregnancy in the confidentiality provision. So since the October Board of Health meeting, the notice of decision was published in the City Record on October 27th. We had the public hearing on November 28th. We received 7 written comments and 2 individuals testified. So the comments reflect uncertainty and a lack of clarity among the medical community about the requirement to report all ITOPs. And in fact, that is why we wanted to clarify the health code to make it incredibly clear that medication ITOPs were reportable. And the comments expressed concern that the information reported could potentially become public. And of course, as we noted previously, medication abortions are already required to be reported, and we are taking the data in an anonymous way. And then once we do have that information, it's stored securely. But we did make some changes that I'm proposing today for adoption. And that's gonna be these are really clarifying changes, and they're gonna be in red on the following screens. So first, we made a clarifying change to the definition of medication-induced termination of pregnancy. We struck the last clause of this definition, so now the definition will read, medication-induced termination of pregnancy means the induced termination of pregnancy using medication prescribed or ordered by a licensed healthcare practitioner. A medication-induced termination of pregnancy occurs in the city when a licensed healthcare practitioner prescribes or orders the medication for a patient. The second change is just adding words to make consistent with the rest of Article 203. And so we just added, really just changed the verb, added a verb, prescribing or ordering, and the little screen is there blocking it, but we added the two words, or ordering, instead of just prescribing. And then finally, we just clarified the reporting time to 5 days. So we just added that within 5 business days, including within 5 business days after the medication, for the medication-induced termination of pregnancy was prescribed or ordered. So in summary, adoption of these amendments would specifically define medication ITOPs as a type of ITOP, clarify that the licensed healthcare practitioner prescribing or ordering the medication is required to report the medication ITOP, and clarify that the medication ITOP is reportable to the department within 5 business days of the prescription or order. In summary, data collection is an incredibly important part of the department's critical public health mission. It's what enables us to act. It's what enables us to focus on the communities that need us to focus and fulfill our mission. And all information that we receive is kept strictly confidential and is protected by federal, state, and local law. So I'm here to ask the board adopt the proposed amendments to Article 203 to clarify the reporting requirements for medication-induced termination of pregnancy. I'm happy to take any questions.
Thank you, Dr. Van Wy, and so we'll take questions from the board. Start with Gail Nelwith.
Dr. Van Wy, thank you very much for this important work. I don't have any questions.
Dr. Hankerson,
No questions, thank you.
Dr. Galvez.
Hi, so this doesn't represent any additional burden to the clinician other than what was already standard practice for
Correct.
ITOP.
Correct. In fact, I will say that we also have, with induced terminations of pregnancy, actually been a little bit more advanced in operability and making it easier for these providers to report to us with batch uploads of data.
That's great, thank you.
Dr. Plum.
So, and that really responds to the comments that were collected during the public comment. They were largely focused on the burden on the physicians and also the anonymity of the data. Thank you.
Dr. Lindsay.
No questions.
Dr. Acosta.
No question.
Okay, thank you very much. At this time, we need a motion to approve the proposed amendments to amend Article 203 of the New York City Health Code regarding termination of pregnancy. Can I have a motion?
So moved.
Can I have a second?
Second.
And now I'll take each board member's vote by name. Gail Nelwith,
Aye.
Dr. Hankerson,
Aye.
Dr. Galvez,
Aye.
Dr. Plum,
Aye.
Dr. Lindsay,
Aye.
Dr. Acosta.
Aye.
With the unanimous vote in favor of the motion carries. Thank you. Final agenda item of the day is the proposed form changes to birth certificates, VR 18 and CMR VR 17. Our presenter is once again Dr. Van Wy, and I will turn the presentation back over to her.
Good morning. I'm glad to be back with you to speak about proposed vital statistics form changes pertaining to some of the things we've been talking about today. So I just wanted to step back to orient everybody to why I'm coming to you and asking for changes to forms. Forms are actually incredibly important to the work we do in vital records and vital statistics. And the city's rules and regulations actually provide 2 legal sources for the form changes that I'm asking you about today. So first, the New York City Charter actually requires the Board of Health to prescribe in the health code the form and manner that vital records information is stored and certificates filed. The second part is the health code actually requires the forms used for induced termination of pregnancy certificates be prepared on forms prescribed by the board. So in June of this year, the Board of Health adopted an amendment to Article 203 to ensure the same high level of confidentiality for medical information reported to the department about spontaneous terminations that's required for induced terminations of pregnancy. And today, the board adopted amendments to Article 203 to clarify reporting requirements for medication-induced terminations of pregnancy. And now, to operationalize these amendments, we're asking that the board approve the following proposed changes to the VR18, which is our induced termination of pregnancy certificate, and the VR17, which is our spontaneous termination of pregnancy certificate paper forms. And then these forms are the basis for what our eVital system is, our electronic system. Okay, so I'm gonna walk you through these changes iteratively, but this is what the current induced termination of pregnancy certificate looks like. We call it VR18. And then we're gonna focus on the areas that are highlighted here in yellow. So you see we're not focusing on all of the form, but just on some key areas. And then this is the current spontaneous termination of pregnancy confidential medical report. It's the VR17. And we're just gonna focus on the heading, the top part of it today. So you have these in front of you, and I'm just gonna go ahead and walk you through what we propose, what the current reading is, what we propose, and then how it would look. And I'll summarize at the end. Okay, so let's start at the beginning, and we'll talk about the top of the form. So on the VR18, we're talking about the instructions. And so on the instructions, it currently says, use this form only for induced terminations of pregnancy, whether surgical or medical. Well, terminology has changed in recent past. And so what we propose is that they should read, use this form only for induced terminations, whether induced by procedure or medication. So the word surgical is no longer going to, would no longer be there. The second change is pertaining to both VR18 and VR17. This is the confidentiality provision. Currently, this reads, only for scientific purposes approved by the commissioner, not subject to compelled disclosure. This is pertaining to the change that you made in June. And the reading would be confidential and not subject to release, except as required by federal, New York State, and New York State law. Okay, so this is how the before and after would look on the actual form and on the worksheet, the spontaneous worksheet. Okay. Next, I'm moving on to a change on the VR18 box number 1. Currently, the form reads date of procedure for termination. We propose that it read date of procedure for medication, date of procedure or medication prescribed for termination, to make it very explicit that medication reporting is required. This is to conform to recent changes in technology. This is what that would look like. Next one. The second change, the second box that I'm going to be referring to is box number 2. It says facility type, and this box doesn't currently have an actual place where we can put the word, or people can check off the box telemedicine. So we're proposing to add telemedicine as a field, a facility type. That's just to improve our ascertainment, to improve our data collection, to inform our interventions. And this is what that would look like. The next box is funding type, box number 4. Currently reads no field for other funding types, and we propose that we just add other specified because practitioners have come to us and say there are actually other forms of ways that people are paying for this service. So this is what that would look like. The next box is box number 5, and this is directly responsive to the concerns that we've heard from the community. And although we currently anonymize the information that we receive, we do so by taking the first 2 letters of the first name and the first 2 letters of the last name, and not the complete name. However, we've identified a way that using our eVital system, we can remove words or any kind of letters entirely, and we're going to we propose replacing the first 2 initials with the eVital case number instead. This will be a reinforcement of confidentiality and make it even more anonymous, the information that we're receiving. So that would look like this. With box 17, we're proposing that instead of reading termination procedure, we would propose the language termination of method. And again, this is to conform with recent changes in terminology. And then we're moving on to the method of termination boxes. So this is boxes 17A and 17B on the VR18. So currently, box 17A reads primary procedure and check only one. We would like it to say primary method of termination. Box 17B reads additional procedures, and then we're proposing that it read additional methods of termination, again, to conform to recent changes in terminology. So this is just the header of the boxes that I'm about to show you, but we would of course want to change these to be consistent with this terminology that we're going to be referring to. So on this slide, I'm showing you the actual choices in that box, and these are current box 17A is primary procedure, and you can see that we proposed the change to primary method, and then the list of things that the provider can select are different from what they're currently there. And this is what we've heard from providers being much more consistent with what is being done and being done now with current medical practice. We actually think this will make it also easier for providers to report to us. This is what this will look like, box 17A, before and after. And similarly with box 17B, it's a secondary procedure, so it's really the same list of things, but it's a secondary procedure or secondary method. So we're proposing that same list again to be consistent, so people can add in the information that they would like to add. And this is what that would look like. And then we'll speak to box 18, which is about some of the contraceptives provided at the time of procedure. This particular box has 3 changes. The current label currently reads contraceptives provided at the time of procedure. Again, we want to change the word procedure to termination. So that would be change 1. Change 2 would be the secondary question of did the patient receive any contraception at the time of procedure, and we would say time of termination. And then the third change currently reads label for options if yes is selected, placed or given at the time of procedure, prescribed at the time of procedure, and proposed is the label for options is time of termination, prescribed at time of termination. And again, to conform with these recent changes in terminology. And this is what that box would look like, the changes, so at the bottom of the screen. Okay. All told, the VR18 would look like this. These highlighted areas are the areas that would be changed to the proposed language if you vote to approve them. And similarly with the VR17. So in summary, these proposed changes would increase the accuracy of reporting and data collection for public health purposes, improve our ascertainment. They would increase protections and confidentiality of ITOP data. And they would clarify to the medical community that the ITOP reporting requirement mandated by the health code applies to medication-induced terminations of pregnancy. They'd update the department's form and data system to reflect telemedicine and include updated terminology and remove patient initials on ITOP forms. Therefore, we request the board's approval of these proposed form changes.
Okay, thank you very much. At this time, we'll take questions from the board, starting with Gail Nowith.
Dr. Van Wy, in the first part of the presentation, you had a slide that spoke to the changes between having the Commissioner of Health report and then changing it to be more broad for the state of New York and so forth. Can we just go back to that slide a second? Is it possible or not?
She's bringing it up.
Okay, no problem. I just want to make sure that I understand the change.
Oops. The previous presentation.
Yes. Yes.
And do you want me, I can go back to the recap slide, okay?
Yeah, the recap slide is perfect.
Okay, this one?
No, it was the one that has, the change in highlights. Keep going. Keep going. This one, thank you.
Mhm.
Okay. So in the confidentiality provision, number 2, VR 18 and VR 17, currently it says it would only, the data would be released only for scientific purposes approved by the commissioner, and there's no compelled disclosure. And I'm assuming that the proposed change is really conforming with the amendments we did to Article 203 of the Health Code, but also to changes in the law. I
Yes.
just want to understand, because it does, when I read it, it appears broader than the original confidentiality provision.
Gotcha. So our assessment, and I can also allow our general counsel to comment on this, our assessment is that this is actually much more defendable and protective than the previous language.
Okay,
So that's why we proposed this change, and we're explicitly calling out the laws that are more protective.
Yeah, just to add on, that neither state law nor city law would compel disclosure, and it's very protective, so just to understand.
yeah, understood, but the situation at the federal level is not quite as cautious. So I'm a little worried about that. I'm not suggesting that there's a problem here, I just wanted to understand it. It does give me cause for concern. Not enough to vote no, but I do want to note that the federal level is where we have our challenges right now as it relates to abortion, termination of pregnancy.
Yeah, I guess I would just offer up that, you know, New York State and city law, if they're more protective, would be covering
Thank you,
issues that the federal law wouldn't.
thank you. That helps very much, thanks very much.
Thank you. Dr. Hankerson?
No questions.
Dr. Galvez?
To the point of clinician burden, just curious what the standard practice is. Is this manually completed, or has it been digitized and available for automated completion through EMR?
So we have a system called eVital, which all of the people who provide services they're registered in the system. They have a username and password and secure access to this system, and they do this electronically. And the thing that I was referring to before is recognizing that a lot of times these are smaller operations with limited administrative support. We've piloted batch uploading, so we're all working towards getting to interoperability with medical systems, but we're trying to make it as easy as possible. So this is something we're working with a number of providers, and some of them are actually doing it already.
That's great to hear, thank you.
Dr. Plum?
No questions, thank you.
Dr. Lindsay?
No questions.
Dr. Acquista?
No question.
If there are no other comments or questions, may I have a motion to approve proposed form changes to VR 18 and VR 17?
Motion to approve.
A second?
Second.
Great, I'll take a vote from each member. Gail Nailwith?
Aye,
Dr. Hankerson?
Aye.
Dr. Galvez?
Aye.
Dr. Plum?
Aye.
Dr. Lindsay?
Aye.
And Dr. Acquista?
Aye.
Okay, thank you. With a unanimous vote in favor of the motion carries. And if there are no other comments or questions, that brings this meeting to a close. Thank you, everyone, for your attendance, thank you to everyone watching, and thank you to the presenters. The meeting is adjourned.
thank you.